As public health officials clamor to remove added sugars from food and beverage products, a new study published by the Georgetown University Business for Impact Center signals that there is much heavy lifting ahead. Full disclosure: I served as an author of the paper. The report noted that added sugars dominate products containing sweeteners, with 87% of items formulated this way. Only 8% of sweetened items contain low or no-calorie sweeteners, LNCS, only, with 5% consisting of a combination of the two. The paper concluded that increased use of LNCs was necessary to eliminate meaningful amounts of added sugars and that LNCS offered effective and safe ways to do so. The low and no-calorie sweeteners of today are nothing like the cyclamates of more than 50 years ago, which the U.S. banned in 1969 when they were suspected of being carcinogenic. But like the children and grandchildren of notorious public figures, today's non-nutritive sweeteners like stevia, sucralose, and aspartame sometimes have trouble convincing consumers and public health authorities that they play an important role. After a careful review of dozens of the most rigorous scientific studies by respected academic reviewers, we saw that substituting LNCS for regular calorie versions using sugar leads to benefits in weight loss, lower body mass index, BMI, and reduced sugar intake. These studies, known as randomized controlled trials, are the gold standard for determining causality, unlike other observational studies often quoted in the media. As the World Health Organization, WHO, and other noted health authorities are telling us to reduce added sugar, consumers are receiving that message. According to the International Food Information Council, IFIC, almost 3 of 4 Americans are trying to limit or avoid sugars, primarily added sugars. And Natural Marketing Institute, NMI, data used in the Georgetown study confirmed that sugar content and added sugars were among the top 4 items checked for most often on food labels. Calories and sodium were the other 2. But here's the conundrum. People don't want to sacrifice taste, or totally ban sweetness from their diets. Surveys by IFIC, NMI and other research firms continually have come to the same conclusion. The number one reason why consumers buy a product is for taste. LNCS can help consumers satisfy their need for taste and help them manage their weight at the same time. In fact, a myriad of popular food and beverage brands already contain LNCS, such as Diet Coke, Dannon Light Plus Fit Zero Sugar Yogurt, Heinz Tomato Ketchup with no sugar added, and Ice Cube's sugar-free gum. The sweeteners have been used safely for decades. Ever since cyclamates were banned in 1969 and aspartame was introduced in the early 1980s, there has been an underlying suspicion about the authenticity of these low and no-calorie ingredients. This comes despite the tortuous approval process required by the FDA and considerable research on the subject.